Welcome everyone to this webinar from the National Collaborating Center for Methods and Tools. Our focus today is mental health focused methods and tools to support evidence-informed decision making. My name is Susan Snelling. I'm a Senior Knowledge Translation Specialist at the National Collaborating Center for Methods and Tools, or NCCMT. And I'm assisted today by Claire Howarth, who will handle some of the technology for us. So glad to see everybody joining in, and let's get to it. So first of all, I have a question for you, and we'll just bring up a poll. You've probably done this before, but you will see a poll come up to ask you how many people are watching today's webinar with you, watching and listening. We know that some people are solo, but some of you perhaps have company. So if you click on your answer and then hit submit, we'll see your answers. So probably about half of you are solo. A couple have 2 or 3 people there still coming in. That's great, and one group has more than 5, so I'm picturing like an auditorium or something, but maybe I'm overdoing it. Anyway, welcome to all of you. That's great to have this participation, and I hope you enjoy the session and find it useful. So Claire, we can close that poll now, and when you're ready to bring up the results, we'll just share those with people for their interest to know who else is out there. In terms of just some housekeeping pieces, we will keep the teleconference line muted during the webinar. So any communication that you have with me will come through the Q&A function. So I'll just move to the next slide. The Q&A is right on the side, the right side, and I'm happy to see your comments and questions at any time. If there's something that comes up that I haven't been clear about, please send me a note and I can comment at the time. We'll also use that Q&A section for questions toward the end, and we certainly will have an opportunity for some discussion. It sounds like we have good connection, but if for some reason at your end you're having a connection problem, there is a helpline here. Perhaps a note in the chat or the Q&A can help you as well. And if you are having trouble, just check that your computer speakers are unmuted and then go to audio broadcast. You should be able to hear okay. So there's the audio broadcast dialog box in case you're getting feedback at your end. Now we've got another poll question for you, just to get a sense of where everyone is connecting from today. So if you would like to take stock of your surroundings and tell us what province or territory you're calling from, or maybe you're even outside of Canada. Welcome to everyone. So we have about half our participants are calling in from Ontario, and I'm in Ontario too. In Northern Ontario today, so welcome to all of you. Some folks from BC and Alberta, welcome. Quebec, bonjour. Nova Scotia, fantastic. And some of you preferring to remain anonymous. Well, that's okay. We welcome you all. So our topic today, I'll do an introduction to the National Collaborating Center for Methods and Tools, And then I will talk about a model for evidence-informed decision-making that we often use at NCCMT. And I'll also talk about some steps in the process of evidence-informed public health. Now, our focus at NCCMT is public health and population health. But as we were going through many of the methods and tools that we talk about and recommend, we noticed that many of these tools have a mental health focus or are coming from organizations that work on mental health. So that's really the reason for this webinar today. Is we thought there may be value in having a particular focus on tools and methods that can really be very clearly applied to mental health practice and practitioners. So still drawing on that same model of evidence-informed decision-making that we tend to use at NCCMT, but bringing your attention to some of the methods and tools if you work in a mental health field. So we're hoping that this will be useful to this particular audience of mental health practitioners. So the National Collaborating Center for Methods and Tools, or NCCMT, our vision is that the effectiveness and efficiency of Canada's public health system will be guided by the production, sharing, and use of high-quality evidence. And our mission then is related to enhancing evidence-informed public health practice and policy in Canada by providing leadership and expertise in supporting the uptake of what works in public health into practice. So we're really focusing on finding out what works in public health and bringing that into practice. And as I'm saying public health, if you're working in a field that you would define more in terms of mental health, I think you'll see that many of the approaches and methods and tools that we will talk about today will certainly apply for you in those fields as well. When we're talking about evidence-informed public health, we're talking about the process of distilling and disseminating the best available evidence from research, as well as from context, as well as from our own experience, and using all of that evidence to inform and improve policy and practice. So another way of saying this is that we take a systematic approach to finding, using, and sharing what works. So the model that I'll be talking about today really is about how to find and use and apply good quality evidence. So another poll for you, just to get a sense of the kinds of sectors that people work in. So again, you can go ahead and click in your answer and then submit. So certainly people from the mental health sector, from public health as well, about 25% in each of those. Research field, government, NGOs. Terrific. So we've got a really nice reach, and I certainly hope that there's something relevant for all of you. I think there will be. And I welcome your comments and questions, because it's always nice to hear from people working in different fields, and for you to be able to hear what your colleagues in your own sector and other sectors are doing and thinking about with respect to evidence-informed decision-making. So thank you for your input, and we'll move on. One of the sources that I want to talk about right away is the NCCMT Registry of Methods and Tools. And you can get to this from the NCCMT.ca website. What you'll find in the registry are resources to support the use of research evidence in public health. You can see the link there. And the registry is free, You can search it for the particular kinds of knowledge translation methods and tools that you're interested in. You will always find a summary statement that describes what that method or tool is or does. So we take the step of identifying and filtering knowledge translation resources that are relevant to health fields, and we see it as a little bit of a one-stop shop for people who do knowledge translation, so that you can find those good methods and tools that will really help you to do the work that you need to do. So it's a lot easier to picture this if you actually go and look at the registry. But what I have right here is just a screenshot. So if you go to the website and go to the front page for the registry, you can see that there's an opportunity to search the registry, and that's usually what people want to do. But there's also some information there about the registry. You can send us a new method or tool that you think would be interesting for people to be aware of. So I certainly would like to draw your attention to the NCCMT registry and welcome you to look around there to see methods and tools for knowledge translation. So I've been using the term methods and tools, and I just want to bring a little bit of a definition to those things. When we talk about a method, we're talking about a process or a series of steps related to knowledge translation. So for example, a framework might be considered to be a method, a bunch of organized steps. A tool is more like an instrument to carry out those steps. So if there's a checklist of things to remember, that's more what I'm talking about with a tool, the way to do a task. That might be around critical appraisal of evidence. It might be around adapting evidence to your setting. So I'll tend to use those words together, a method and a tool, but if you're wondering what the distinction is, perhaps this definition will help. So here's a model for evidence-informed decision-making in public health. If you don't work in public health specifically, you can probably just substitute the sector that you work in and see if this still applies. I bet it will. So I'll quickly walk you through this model, because when we're looking for the best available evidence, we often go to the bottom left corner, the research piece. We're looking for research evidence, and that for sure is going to be part of our approach to evidence-informed decision-making. But we also recognize that in our fields, we also have to take other things into account as we make a decision about what to do, what's going to work in terms of interventions. We also think about then community health issues and the local context. So what's happening in our community? What are the health issues? What's most important? We think about community and political preferences and actions. Some things that would be acceptable in one community simply would not be acceptable in another community. And we have to take that into account when we make a decision about what to do. Public health resources are really important. You may have the greatest idea in the world of what would work to solve a problem, but if you don't have the money to pay for it, it's not likely to work very well. So resources in terms of money are important, but also in terms of skill sets, capacity, other kinds of resources come into play as we try to decide what to do given the evidence that we have. And then tying all of this together, our expertise in our field gives us also some sense of what works, what we know or suspect to be true, what people emphasize in their experience. So all of these features, all of the ovals in this model have an influence on decision making. So although in our approach to evidence-informed decision-making, we focus on finding and using good research evidence, all of these factors will come into play as we decide to implement a certain intervention or change something that we're doing in our community programming. Now, the other model or approach that I want to talk about, and I'll be talking about this one really for most of the rest of the webinar, is this model of stages in the process of evidence-informed public health. We call this the wheel. And if you're familiar with NCCMT work before, you've probably heard of the wheel or seen it in operation. There are 7 stages in this process, and for the remainder of the webinar, what I'll be doing is looking at methods and tools for each of these steps so that you can then walk yourself through those processes and make evidence-informed decisions in public health or perhaps in mental health if that's the field that you're working in. So more to come on each of these stages in the process. I want to start by framing this in terms of a little bit of a scenario. Sometimes it helps just to ground what we're doing. So just imagine that the reason you want to start looking at evidence and being able to use it is because you are a person who's working with homeless populations who experience mental illness. And let's say also that you are interested in structural or social interventions to improve their health. Now, if that scenario is not something that you can relate to at all, not to worry. You can think of your own scenario and try to use the methods and tools that I'm going to talk about to apply to that scenario. But this is an example that I'll be drawing on just as we go through to give some more detail about how we would actually use some of these methods and tools to answer a particular question. So our question really for this webinar is how can the steps of evidence-informed public health that I just showed you in the wheel be applied to this scenario? So if we're working with homeless populations who experience mental illness, we want to find some sort of intervention that has a structural or social component to it that would result in improved health. Where do we start? What do we do? The steps of evidence-informed public health will help us with this. Now, I want to give you a warning right up front that the focus of this webinar is not about the findings of evidence that will answer this question or tell you what to do in this scenario. We're going to use this as an example, but you won't necessarily know the answer of what's the right intervention to do. What you will know, though, by the end of the webinar is a process so that you can find and appraise and use the evidence that's out there on this topic or others as well so that you can answer your own questions in an evidence-informed way. So we're much more about the process today than the content, but it's nice to have some content just for framing, and that's really how I'm using this scenario. So we'll start the wheel at the define step. Now, it is a wheel, so you can start anywhere, but when we're starting at define, we're looking to define the question or the problem that we want to bring evidence to bear on. And sometimes what's helpful in defining a question or a problem is to have a framework to start with. So one of the resources that I want to draw your attention to is a resource called the Population Mental Health Framework, which is from one of our sister NCCs, the National Collaborating Center for Healthy Public Policy. The link is there for you. So I'm not going to go into this model in great detail, although it certainly is very interesting to read about, so I suggest it to you if this seems like something that you would want to dig into a little more. But what I do want to point out to you about this framework is that as you're starting this step of defining the question or problem, it's helpful to have some terminology to think about, some concepts that will guide you to the evidence that is most relevant for what you're trying to do. So in our scenario, we have a situation where we're interested in homeless populations who experience mental illness. And so in this framework, you can see in the rightmost box, they're describing that health outcomes and mental health outcomes are related. So there's an arrow kind of going back and forth between those. And just below that, it's described that there are various mental disorders indicators, so different ways of measuring mental disorders, as well as ways of measuring mental health. So we have this sense here, it's part of a concept called the two-continuum model of mental health, and you can read more about that in that source if it's of interest to you. Why this is of interest to me as I'm trying to apply this model of evidence-informed decision-making is that it gives me a sense that I might want to look at not only research related to mental disorders, but also research related to health outcomes and mental health outcomes. So on the mental disorder side as well as the mental health side. And then in the box toward the bottom, we're seeing in this framework that it's possible to think about population mental health policies and interventions as being perhaps structural or social or individual. And I've already said in the scenario that maybe just given the kind of work that I do, I'm not so much interested in interventions at the individual level, but I want to find evidence that's related to social factors and structural kinds of interventions that might be helpful. So just by finding a framework that lays out some of the issues or topics related to the particular question that you have in mind, it helps you to define your question. And I'll show you how that works on the next slide. We tend to use a model called PICO, probably very familiar to you. So PICO stands for population, intervention, comparison, and outcome. When we are getting ready to search for evidence about what interventions would be effective or useful, it's helpful to pull apart your question in terms of these four factors, because most evidence can be described in terms of these things. What population was that evidence founded on? What is the nature of the intervention? What's the comparison group, if there is one? What kind of outcomes are of interest? And by thinking back to that framework that I showed you, we may have some idea already about how to describe interventions or how to describe the outcomes that we might expect if we do a particular intervention related to mental health. So if we apply the scenario, our population, the P of PICO, we might define as homeless or high risk. The intervention we might be interested in would be a structural or social intervention, and you can get more or less specific depending on your preference. We won't necessarily specify a comparison in the scenario that we decided on, but we do know that we're interested in the outcome of a change in health. Now, this is just one way that we might apply a scenario, but if you're trying to do this for another scenario, there is a tool. You can find reference to it through the registry, and I'm going to be showing you a lot of these links where you can find the tool through the registry. So this tool is called Developing an Efficient Search Strategy Using PICO. So when you're trying to get ready to search for evidence, you can use the PICO format, and this tool, which I'll show you here, this is the top part of it anyway, just breaks down that question into those PICO components. So this is a tool because it just helps you to fill in the blanks and prompts you a little bit to think about what evidence you would want to look for or how to describe that evidence. Now, it says here in the leftmost column from a clinical question. It doesn't actually have to be a clinical question. It could be an applied research question. So don't be worried too much about that if you feel that the question that you have is not of a clinical nature. Could also be community-based, for example. So this tool, which you can find through the registry at NCCMT.ca, will just help you to be sure that you're developing a search strategy that covers all the available bases. So that was our first step in evidence-informed decision-making, is just defining the question. What is it exactly that we want to know? So we want to know something about homeless or high-risk populations who experience mental illness. We want to know about what structural or social interventions out there might have an effect on health outcomes. Now, armed with that definition, then we can move to the second step, which is search. And in this step, we are actually doing the search for the research evidence. And I have a tool for you. So for searching, the question is, well, where are you going to look for that evidence? So as a way of assisting people with that, there are lots of databases out there. But the NCCMT has some search pyramids, and I'll show you an example of one in just a moment, that are pre-populated with good sites for finding, in this case, mental health-related evidence. So we have pyramids on a number of different topics. Mental health is one of them, so that's the one I'm mentioning today. But there's also a pyramid for good sites for evidence related to injury prevention, health communication, environmental health, healthy habits for adults and for children. So with the pyramid, the idea is that you start at the top for the most synthesized evidence. And what we mean by that is that the evidence has been brought together, pre-digested for you, often pre-appraised as well. And the reason we say to do that is, first of all, that it saves time. And you remember from our vision and mission is that we are interested in efficiency here. We're interested in finding the evidence so that we can apply it. So it's important to be efficient in that search so that we can get on with the applying, but still be doing a good job in our searching. So synthesized evidence allows us to be systematic as opposed to just finding some random thing and saying, okay, good enough. So let me show you what I mean with the pyramid. If you go onto the NCCMT website and go to the mental health pyramid, this is what you'll see. And I'm going to click through 3 looks at this. This first slide looks at the top part of the mental health pyramid, and that's where we suggest people start. Start looking for systems, although we don't find too many of those in applied contexts, but summaries. So what you'll see then on the right is some good sources of summaries related to mental health. So we suggest going to the National Guidelines Clearinghouse, the NICE website, And you'll see that those ones on the top are described as pre-appraised. This means that when you go there, you'll have some sense that what's there is of a certain level of quality. Someone else has done the work to appraise the quality of those summaries. Now you'll see the orange warning in that left panel of the slide beside the pyramid, and everything that comes below that has not been pre-appraised. It doesn't mean that things below that are not of good quality. It just means you don't know that they are of good quality, so the onus is on you to appraise the quality. You need to do your own critical appraisal of information you would find there. So, for example, the Canadian Best Practices portal from the Public Health Agency of Canada would be a good site to go to for mental health summaries, and you'll need to do appraisal of that evidence before you use it. Now, this is the summary level of the pyramid. If I go to the next slide, we're moving a little bit down the pyramid. So if you didn't find a summary that really answers your question, at that point you would go to syntheses or synopses of syntheses. So if you're looking for syntheses, these would be things like systematic reviews, meta-analyses, and these can be great sources if you want to get a lay of the land in terms of what people are finding about your particular research question. So if we're working on our scenario, you might be looking for a systematic review related to improving health for homeless populations who experience mental illness. So where could you look? Well, we've got some pre-appraised sites for you. healthevidence.org, which I'm going to show you a little bit more detail in a second. Public Health Plus is there. The EPPI Center Knowledge Library is a good database. The Guide to Community Preventive Services, and so on. You're just seeing the top of that, but if you were live, you could scroll down to see other sources, the pre-appraised ones at the top, and the other ones that have not yet been appraised below that. And then if you don't find anything in the summaries or the syntheses, then you would move down the pyramid to be looking for studies or synopses of studies. And the reason that we say don't start at the bottom but start at the top is that when you're looking at single studies, it's challenging to be systematic to look at everything because there's so much out there. So it's much better to be looking for syntheses because someone else has done the work for you. Often with a meta-analysis, they've also sort of put together those data in a quantitative way so that you can see the size of the effect of certain interventions. So if you don't find anything at the top levels, then you would move down to the bottom of the pyramid and be looking for single studies. If you're looking for single studies, Public Health Plus is also a source there. The National Registry of Evidence-Based Programs and Practices. This is an American site that will also point you to some studies related to mental health promotion, substance abuse prevention, and so on. And then some additional sites where you would have to do your own appraisal, but still could be some really good sources of single studies. Mental health programs for Aboriginal peoples in Canada might be of interest. And particularly for you on the webinar today, if you work in a mental health field related to Indigenous peoples, this may be a site that would be of interest to you. So this is the Network for Aboriginal Mental Health Research. The focus there is on programs and models, so not only research evidence, but certainly lots of that there. So these pyramids can help you then to figure out where to search, where to go, so that you're finding the most relevant evidence and doing that in an efficient way by starting at the top of the pyramid and only moving as far down the pyramid as you need to before you have found evidence that can answer your question. Now, a couple of slides back on the pyramid, one of the sources for summaries was healthevidence.org, and I want to draw your attention to that tool. This is a tool that will help you with searching, and I'm going to show you a little bit about how it works with some particular features that are relevant for mental health topics. So when you log on to healthevidence.org, this is the front page. Most often what people want to do is to search healthevidence.org, which is one of the tabs on the top. So if we go to search, we get a page that looks like this. I generally suggest that people do an advanced search because it just gives you a lot more options. But if you want to quickly try it out, you can just type in that box that's right in front of you there and search. You'll see that there are almost 4,000 reviews on this site related to topics on public health, population health, but as you'll see, there's lots here related to mental health as well. So let's go to the next slide. So if I do an advanced search and click where the circle is, this is the screen that I get. And the thing I want to draw your attention to is right at the bottom, I've checked off mental health. So this is a really easy way of searching through some of the tags that are already there for the summaries, systematic reviews, and so on that are on this site. So you don't actually have to type anything. You can just click mental health and see what it brings up for you. I'll also draw your attention if you're interested in addictions, for example. Right at the top of that box, under topic area, you could check off addiction and substance use or anything within that. You can check more than one thing. So lots of flexibility here. You can enter search terms at the top if you want to type. But let's say that we just did this search that's shown here, checking off mental health. What would happen? Well, we get 801 results. So this tells us that there are 801 systematic reviews or meta-analyses that are listed here related to a mental health topic in one way or another. Now, I'm all about efficiency here, and there's not really a way to be efficient about going through 801 results. So what I would probably do then, having received this result, is I would go back to this page and check off something else that would narrow the results. So what I'm going to show you is if I had checked off, in addition to mental health, checked off under population, high risk. And you can't quite see that on this slide, but believe me, it's there. So if I check off high risk as well, which is one of the population groupings, I get 66 results. And from the point of view of evidence use, this is more realistic. You could go through 66 results and do that in a pretty efficient way to find research that will actually answer your question. So I'm going to draw your attention to one of these systematic reviews right here, number 6. So just by scanning through the titles, you can say, okay, crisis intervention number 1, that's not quite what I'm looking for. Organizing healthcare services, that's not quite what I'm looking for. But it doesn't take long to just do a quick title search down here. So I get to number 6, and it is effectiveness of interventions to improve the health and housing status of homeless people, a rapid systematic review. And I say, yes, thank you very much. I am interested in that one. That seems relevant to the question that I defined, and now I'm searching for. So there may be others as well, so I'm just giving you an example of how this might work. If we check this one off and follow that link through, what we get then is the abstract from the article and the citation, but we also get a couple of other things that make Health Evidence a really nice site for you to be aware of. One is that some of these articles are summarized. That is, Health Evidence has actually done a summary that will give you a little bit more insight into what they found. You'll also see right beside that circle for summarized that there's a quality assessment been done. So the quality of this systematic review is 9 out of 10. So that's strong. That should give you confidence that this is something that would be good evidence for you to look at. So if we click on that circled area with the summary, which can also be accessed there, this is what you get. And you'll see we've come back to PICO, the define step that we had looked at. So Health Evidence has looked at that systematic review and said, okay, let's think about this in terms of how they've defined their topic. What is the population that they looked at in the systematic review? What was the intervention? What was the comparison? What were the outcomes? So this gives you a sense, without having to read the article yet, whether this is going to be helpful for you. And it looks like from the scenario that we defined, just from looking at those 4 lines, this is absolutely something that would help us to answer the question that we have about what interventions would work for this population and for the outcomes that we're interested in. Now, this is just one example. There are, of course, almost 4,000 others on Health Evidence, so you can find lots of systematic reviews on many topics. But you can, and you can do the search in a number of ways. So I see a question here about can you do Boolean searches, which is with and or. Yes, you can. So right at the top of that search page, you can type things in and do that with and or. So there's quite a bit of flexibility there if you want to search that way. You can combine those searches with the drop-down menu as well. So that's Health Evidence, and remember we're in the search phase of the evidence-informed decision-making process. So Health Evidence is one source that can help you to find mental health-related information, among other things. Now, also, just as you're searching, I wanted to draw your attention to the Evidence Exchange Network for Mental Health and Addictions, another source of evidence, among other things on this website, but we're interested in evidence today, and here specifically related to mental health and addictions interventions. So certainly something for you to check out if that's the field that you're working with. And to make another great connection between the Evidence Exchange Network and Health Evidence that we were just looking at, if we go back to the Health Evidence screen, you'll see here that there is an option within Health Evidence to search EENet to look specifically for research evidence on mental health and substance use. So there's kind of a nice interface there between what's on Health Evidence, what you'll find on EENet, and that might be really valuable to those of you who are working in the field of mental health and substance use. So I won't demonstrate that right now, but pretty easy. Just make the click and see what happens. You'll come up with 300 or so sources if you click on that and nothing else. But you can still search and refine your search. So some tips for that searching phase: choose the highest possible level on the pyramid, get those most synthesized sources, because that will save you money and save you time. The pre-appraised sources make your search more efficient, so we really suggest to do that. If you want to learn more about searching, go to the Learning Center at NCCMT. There are online modules there on all of these 7 steps in the process, including searching. So if you want to build some skills related to searching, this online module probably will take you 3 hours or so. They're free, and lots of capacity building possible through those online modules. Now, moving along on the wheel, we get to the Appraise step. So at this step, we are looking to critically and efficiently appraise the research methods that were used in whatever evidence we found. So in our example that we just did, we went to health evidence. We found an article that was a systematic review that gave us some information about a topic of interest to us, homeless populations and ways to improve health using some social or structural approaches. Now, we're fortunate in that case because health evidence had already done the appraisal for us. So again, for efficiency, that's awesome, because if we trust the appraisal that they've done, and I do, then we don't have to do it again. But sometimes you will find sources where the appraisal hasn't been done, or you just want to check to be sure that you agree with the appraisal that was done by the source that you're looking at. So we have some tools for you, all of which you can find linked through NCCMT.ca. So there are lots of tools out there related to critically appraising research evidence. What I've got here is tools for different kinds of evidence. So if you're appraising a practice guideline, there are certain ways of doing that, and the Agree To instrument is one that's really set up to appraise the quality of practice guidelines. If you're assessing the quality of a systematic review, the AmStar tool is a nice one to use. If you're looking at single studies, the CASP tools, or Critical Appraisal Skills Program, has checklists for different kinds of single studies, whether they're randomized controlled trials or other kinds of designs. So lots of tools available out there that will guide you through the process of critically appraising. When you are appraising, what you're doing is looking for sources of bias in the research evidence that you've found. So you're asking the question, is this research or review of good enough quality that I should read further? So it's really that very intermediate step between searching and actually using the evidence to say, should I even bother reading this? Because there are some sources of research and other evidence that you actually should not even bother using. The quality is so poor or the bias is so strong that you shouldn't, in good conscience, be using that evidence to make decisions with. Now, all research has flaws, all of it. Some flaws are more serious than others. Some sources of bias are more serious than others. And if you need help figuring that out, the appraisal module on NCCMT will help you to kind of discern what we mean by most serious. But when we're appraising, we can use the checklist that I just mentioned to guide us through the hallmarks of a good review or a good randomized control trial or a good qualitative study. And if you're going to spend time reading, you want to spend the time on evidence that is pretty free from bias, pretty good quality, so that you're getting a good answer that you can rely on down the road. So I mentioned the online learning module. There are lots of them, but there is one about appraisal. If you're really intrigued and want to spend a whole week doing appraisal and other things as well related to evidence-informed decision-making. Coming up very soon in May, there's a week-long workshop at McMaster, and there's a link there if you want to follow that along. So you never know. Sometimes a whole world could open up and you want to spend a week doing this. Now, after that appraisal step, we get to the synthesize step. So we've done our search. We've found some evidence related to interventions that might improve the health of homeless populations who experience mental illness. And we've appraised the quality, or maybe in our case we were fortunate enough that the appraisal had already been done, as it would be on health evidence. So we've got some good evidence that we feel is free enough from bias that we want to read it and rely on it. So that's what we're doing in the synthesize step. The challenge that we often have is that we're drawing from many sources. I'm giving the example of just one systematic review, but often you would have more than that to draw on. And so not only are we trying to figure out what did the systematic review show, the interpreting part, but we also want to figure out how to put multiple findings together and sometimes how to decide between results that conflict. And this can often be a really frustrating thing for people, even in our everyday lives. You know, we find that, oh, chocolate's good for you, but today some other study came out saying chocolate's not good for you anymore. Red wine, good, red wine, not good. How do you navigate between them? So when you're synthesizing, pulling all of the evidence together, sometimes you're going to need to figure out what to do when the evidence conflicts. So a tool that I have to suggest to you is one called it is a briefing note tool, Decisions, Rationale, and Key Findings Summary. So this is a tool that will just provide some structure for a briefing note to inform decision makers, maybe even yourself if you're making the decision, but maybe it's a way for you to communicate research findings to someone else who's going to make the decision. So it can be really nice just to have a template to say, okay, here's how I'm going to structure my briefing note. And it may be that your organization already has a briefing note template, so sometimes that can be used as well. But take a look at this briefing note template. It's particularly good at finding a way to identify actionable messages to inform program and policy development. So here's what it looks like. It's a little bit small probably on your screen, so you'd want to actually follow the link and take a look at it in more detail. But just to give you a feel for it, it's got boxes and then prompts to tell you, okay, put this in terms of the issue, describe a little bit of background there, and the boxes will move if you've got more or less information to add. What's already happening. And then just at the bottom of the slide, you'll see the section that talks about evidence. And you will there put results of the search of research evidence and synthesize those all together. What do we know from the evidence? What works? What doesn't work? What don't we know yet? Sometimes that's still the case, that we just don't have enough evidence for something. That's important to note as well, that the jury is still out. So this briefing note tool is just a structure. It's a tool for helping you to synthesize lots of evidence. Now, I mentioned that sometimes you're going to need to deal with evidence that seems to conflict. And in that case, often what we find is that it's not so much that we're having two conflicting findings that are of equal quality and equal weight. What we want to do is to assess those sources in terms of their quality, so that's an appraisal task, and choose those that are more reliable, more free of bias, higher quality, because that will get you closer to the truth. If you have something like a systematic review that came out 20 years ago and one that came out last year, you should be comfortable using the one that came out more recently because it will have more up-to-date knowledge. It probably includes what was in the one from 20 years ago, plus everything that's been learned since then. And sometimes there are things that are just more relevant to your question as opposed to something that's peripheral. So although sometimes it seems like there's an out-and-out conflict between the findings, when we dig a little deeper, we can often find reasons to prefer some sources over others based on their quality, based on how recent the findings are, and based on relevance to our question. And because our orientation at NCCMT is very much about being able to apply the findings and use them to improve our practice, when we're looking at all of these different sources, synthesizing them, what we want to do is to identify findings that we can take action. What should we do? What are the options? And the briefing note tool will help you to get to not only what were the findings, but what do they mean for us in terms of some of the decisions that we might take, some of the actions that we might put into place. Next step, adapt. So let's say that we've looked through our evidence, we've found some systematic reviews or maybe some other sources related to our question of interest. But sometimes a lot of the evidence is done perhaps in another country, for us often in the United States, although not always. Sometimes we find that a lot of the research is done in an urban setting. And if we're working in a more rural setting, we may have questions about whether that evidence can really be used in our own context. So the adapt step says, before you go running off and making a decision based on what you found, you need to take into account what's happening in your local community and the characteristics of your community to see whether that evidence really will apply to your setting. So back to this model, we looked at this right at the beginning, saying that when we're making a decision, we need to take a lot of things into account. And in this adapt step, we really see how this starts to play out. So let's say that we have found our research related to homeless populations who experience mental illness, and we were looking for some structural interventions, and that research demonstrated that by providing housing and housing supports, you really can improve the health of homeless populations. So I'm giving a very quick summary, but let's say that that's what we found in the research. Pretty good evidence to support that. Now, does that mean that we go and advocate for housing and housing supports? Well, let's take a look. As this model guides us, we're also needing to think about our own setting. So maybe that worked in an urban context, but if we're not working in an urban context, we'd want to ask, would this still work for us? So this model suggests to us you'd need to look at the local context and what's happening. You know, is there a real concern about the health outcomes for people who are homeless? What are the political preferences and actions? Sometimes there's a window that opens where people are saying we have to do something about this now. That's the best case scenario. And other times you realize that, you know, maybe there's a government changing over or something where now wouldn't really be the right time. So you think about just what's going on in the community at this time. Doesn't change the research findings. It just changes how you might think about implementing those research findings in your context. Public health resources, well, housing is expensive. And so even though you may have found good research evidence to suggest that housing and supportive housing can really impact the health of homeless populations, it may be that the resource burden makes that very, very difficult to do, or you might only be able to do it in a certain small scale. And then your own expertise and the expertise of your colleagues also, of course, comes into it in terms of the kinds of decisions that you would make based on that research. So that's a quick walkthrough of how the decision might actually be made, taking into account that research, but also taking into account other factors that would need to come into play to make a good decision. Now, if you're looking for a tool that will help you do that adapt step, we have a couple of tools to suggest to you, both of them related to the applicability and transferability of evidence, which is really what we're doing in this adapt step. The first tool is called It Worked There, Will It Work Here? A tool for assessing applicability and transferability of evidence. And then the one just below that, is this evidence useful to me, is a version of the first one that has a little bit more health equity content. It's from CRICH and might be of interest particularly for the example that we're using with homeless populations, to really think about the applicability and transferability of evidence with a health equity lens. So that might be a relevant tool for this particular question. Both of them really good tools, and as I said, the one is based on the first one. And again, an online learning module. If you want to dig into this in more detail, this module will really help you to put yourself in a situation and actually think through the steps, the questions that you would ask as you're trying to adapt evidence to your local context. This, I would say, is probably as much of an art as it is a science, and it really draws on getting good input and getting the right people together. So the module is one way that you can dig into that in a little more detail. But in general, as we're entering this adapt step, you would want to think about a number of perspectives guided by that Venn diagram model. So in our example, if housing supports are known from a research perspective to improve health outcomes, before you sort of go ahead and create a master plan to do that, you would develop your local approach that thinks about not only the strength of that research evidence, but also what stakeholders think about that, what they value, what's going on for them, what they've tried before. That's not to say you shouldn't try it again, but there may be things that you can learn from the research evidence or other contexts that would help you to understand maybe why it didn't work before. So stakeholder perspective is really important. What's going on in the community, what's happening in the media, and so on. The political context is important to think about in terms of your timing, where you might find champions, that kind of thing. Health status, how much of a priority is it to increase or improve health outcomes? If a report has just come out that says this is a terrible problem and we have to do something, that may be your window to adapt the research evidence to your local context. And then, of course, resources always come into the decision-making as well. So overall, the question that you're asking here is, there are potential interventions out there that may have research evidence to support them. How can you adapt those to be appropriate for your community so that you're making the best possible decisions? And sometimes adapting potential interventions to work in your community means that you have to stop doing something else. The pie is not infinite, so if we want to introduce something, we sometimes need to stop doing something else, take it away, modify it, and the applicability and transferability tools that I just referenced also have a version of them that will help you to think through what would be the consequences if we stopped doing something. Or, for example, if the research evidence showed us that what we're doing doesn't work, what do we do to change that, to withdraw that from the community? It's not something that you want to take lightly. So, again, that model helps you to decide not to do something and the steps that would be involved in adapting that decision in your local community, just as much as you might have to think about how to introduce something new. Now, moving along through the wheel, the implement step. So we always, I think, especially those of us who work in applied and community kinds of fields, we like to get to this step, right, because it feels like, okay, we're doing something finally. The steps up to this are leading us to implement things that have a good chance of working, of having the desired effect, of being acceptable and effective in our community, of being responsible in terms of resources. So out of the multiple choices that we have, we want to, at this point, be implementing things that will work in a way that will lead to their success. So we need to decide whether to implement something and then plan how to do it. So a really interesting tool or method, actually, comes from the Mental Health Commission of Canada. This is a knowledge translation guide called Innovation to Implementation. So here we are in the implement step, and so of course it seems appropriate to be looking for a guide that talks about implementation. And really, when we're talking about implementing something based on research evidence, we are talking about knowledge translation. We found the knowledge in the research evidence, and we translate that to result in changes in policy and practice. So this guide, you can see the link to it through our registry. If you go to the registry, there will be then a link to this report, or you can just Google it. So in this model, they follow the model that's shown on the screen, and you'll actually see it's got some pretty good alignment with the kind of model that we describe for evidence-informed public health, which makes sense because both of the models are thinking about and talking about knowledge translation. So just to quickly go around this model, then we would state the purpose of our intervention, so something related to supportive housing, related to improving health outcomes for homeless people experiencing mental illness. Our intervention would be something related to housing. At step 3, we need to think about who needs to be involved, who do we need to talk to, what steps would we have to take, so kind of breaking down the implementation to specific pieces. Agents have changed, so this is where the champions come in. Who's going to lead this? Who's going to get people on board? That's a really important piece of any knowledge translation approach. Designing the KT plan, so here we're starting to think about key messages for particular audiences. What do we want them to know? What do we want them to do? And it depends, of course, on the particular stakeholder. Then we get to the implementation phase and the evaluation phase, very similar to our evidence-informed public health model. So this model, which is in the innovation to implementation document may be really useful to you if you work in a mental health field, because it was really developed with that context in mind. But I would say the alignment is really there for any kind of population or community health approach. Well, we're almost around the wheel. Evaluate is the next step and the seventh step in the process. And here we're trying to assess the effectiveness of the change in practice or policy. So let's say that we have implemented a change, perhaps introducing some particular support resource people in housing contexts where homeless people are being housed. So big task, but let's imagine that we've been able to do that. Well, we've been trying to do that from an evidence-informed point of view. So we want to know whether our approach actually was evidence-based. Did we actually make a change that is going to be effective based on what the evidence would tell us? So again, I'm drawing on the innovation to implementation model from the Mental Health Commission of Canada, and their recommended method for evaluating the effectiveness of our changes based on our knowledge translation is actually based on the RE-AIM framework, which is probably familiar to many of you, but really works very nicely, I think, in this context. So if you've implemented a new innovation that is intended to improve the health of a population, you will want to ask this kind of question about reach. Did it actually get to the target population that you wanted to reach? Was it effective? Key question there. Was it adopted by its intended users? Sometimes when things don't work out, it's because the people who needed to deliver it didn't really get on board, or they didn't know what they were going to do, or they weren't sufficiently trained. So it's not that it was a bad idea, it just didn't get adopted by those people who were in the best position to deliver it. Was it implemented in the way that it was intended? High fidelity is another way of saying that. And then was it maintained? Many of the interventions that we use in public health and in mental health have to be sustained over a long period of time in order to be effective. And we want to know about the effectiveness of these interventions for the long term. So looking at maintenance is another aspect of evaluating the success of our evidence-informed decision-making, or our knowledge translation is another way of saying that. Another tool that may be of interest when you're at the evaluate stage, so you've tried to use some evidence in making decisions, maybe on a really big scale, maybe just in a small scale within your own practice or within your small team. This tool here, called Improving Future Decisions, Optimizing the Decision Process from Lessons Learned, is a reflective practice tool. So really just guiding you through some questions. I know it looks a lot like the other tool and it is formatted similarly, but the questions are different. So sort of in the middle of the page there, you'll see that it prompts you to ask about the decision process. What was supposed to happen, what actually happened, and why. Some other questions about lessons learned and your recommendations. Evaluating has a lot to do with just reflecting back to say what worked, what didn't, what would we do better next time. And certainly it is true in knowledge translation, as in any other undertaking, that we don't get it right all the time, certainly not the first time. And so as you're moving toward a more evidence-informed approach, you need to learn how to do that. How do we bring evidence to bear in the work that we do? And so just having a guide like this one to prompt us to take a moment or two and think about what we tried to do, what worked, what didn't, what would we do differently next time, and having a written record of that can be really helpful when, you know, as things do, they cycle back and 5 years from now, people are trying to do something similar. They can maybe reflect back to say, aha, something similar was tried 5 years ago, and here's what we learned about it. So this can be a really nice prompting tool. Whether you use that tool or just some other approach, you will want to do some kind of evaluation as you head down the road of evidence-informed decision-making. So what was your process? What can you learn from it? How could you improve next time? How would you know if the evidence had made a difference and whether the implementation of your intervention actually worked in your setting? Sometimes you'll need to gather baseline data to really say, did something change from before you implemented your intervention? So that's a pretty core concept in evaluation, of course, is to have some baseline data, if it's possible, for the work that you're doing. So that was a pretty quick trip through the 7 stages in the process of evidence-informed public health. Thinking about the methods and tools that can help you to do each of those steps, with a focus on some mental health relevant resources where those exist. Now, I'm sure I'm not the first person to ever bring this kind of idea to your attention. Lots of you are doing some really good evidence-informed work. So I'd like some feedback from you. Thinking about the 7 steps, where do you see the greatest challenge in being able to do these well? And so you can click on your answer and submit, and we'll see how where people see the challenges. And also, we're just about to enter into our question and dialogue period. So if you have actual comments about what makes these pieces challenging, you can put that in the Q&A as well. So just some results as they're coming in. Yeah, it's those later steps that often pose the problem. So for implementing, really challenging, adapting to the local context can be very challenging. Synthesizing, bringing together, those are sort of the top categories from your experience. Each step, I would say, probably has its own challenges, but lots of challenges related to the adapt and implement steps. I agree with that. So, comments, questions, ideas. You can use the Q&A to post your comments and questions. Maybe you have some examples of things that have been really challenging about this. Maybe there are some questions about some of the resources that I've shared with you. So I would be happy to see some of your comments and questions. If you are posting something, just be sure that you're sending your posting to all so that everyone can see it. And just as you are entering comments and questions, I'll just mention to you as well that the slides and the audio recording will be available. So the slides will be available in English and French on slideshare.net under NCCMT, and the audio recording will be on YouTube. So if you want to share this or have access to those links within the PowerPoint, that will be available for you. And in case you have to run, we are really interested in your feedback. So we do have a survey available, and we are interested in evaluation. So we do take an interest in your feedback. We use that, and I would really welcome your comments and feedback so that we can continue to do better. So, some comments and questions. So, suggestions for the best process for using the wheel. Who should be part of the process from the beginning? And how do we include non-traditional partners, or should we? So, fantastic question. And thanks for thinking about that. We talk about the stakeholders being really involved as we think about the later steps, adapting, implementing. But of course, even framing your question right from the beginning, I'm sure we've all had the experience that what we think is the really important question maybe isn't the most important question from the point of view of someone with lived experience of a particular condition or setting. So bringing in stakeholders at any stage, and they might be different stakeholders depending on the stage, can really enrich your understanding of even PICO. What is the population? What is the intervention that we should most be interested in? And non-traditional partners takes a little bit of work if we haven't formed those relationships previously. But it can enrich so much our understanding of the issue that it certainly can help to have an evidence-informed approach that draws on evidence not only from research, but also from the expertise that people are bringing from their own experience, as well as from their other sectors that we may not have very good knowledge of. So thanks for that question in terms of who to engage and how do we bring stakeholders and partners into the process. So just a question about the one-week training in May, and I'm going to go really back to that slide just so that I can give you the right information. I'm going to click through here. This course, the link is there, ccebn.mcmaster.ca, looks at many aspects that we talked about today in terms of evidence-informed decision-making, lots of practice and focus on critical appraisal so that you can really understand the quality of the research that you're looking at and feel confident about using that to make decisions. This course happens every year, has happened every year for the last several years. So if this May doesn't work for you, check it out because it's usually the first week of May at McMaster. So that's great that you're interested in that, and maybe we'll see you there. And we have the link to that in the Q&A. Thank you for that. Now, question, how is it different to use this process rapidly compared to an ongoing iterative process? The speed with which you can go through the process really depends on a number of things, but certainly the magnitude of your question. So if you have a very specific question, it may be entirely appropriate for you to find one systematic review. If you're lucky to find one that is recent and of good quality, that may be the guideline or the answer that you need to answer a particular question that you have. If you're doing an evidence-based approach for an entire program or your entire department or something of that nature, obviously it's going to take a lot longer. My advice to people who are concerned or cautious about how long it's going to take to take an evidence-informed approach is carve off a chunk of it. Do a little piece, get used to the process, because like with any process, it gets faster as you go, and the question talks about an ongoing iterative process, and I think ideally, once you become really adept at evidence-informed decision-making, this will just become a natural way that you do business. You evaluate something, and that feeds into your next question that you define and search and so on. So ideal to be able to do that at that level, but starting small can be really effective at building skills and building confidence and building familiarity with what it takes to create a change in an organization. It's not easy, and I'm sure I probably don't need to tell you that because you've probably all been part of that. But change can be a slow process. Hopefully, having compelling evidence that's synthesized in a good way and adapted for your local context can help with that kind of buy-in and progress through the steps. So we have links for the survey. We have links for the SlideShare account, and I'm going to go back to that one as well. Survey link. If you're not busy tomorrow and you want to go to another webinar, we have another one, NCCMT Spotlights on Method and Tools. This will be a focus on a tool for sharing best practices from the Johns Hopkins Bloomberg School of Public Health. The information is there, and you can find the link through Health Evidence, but the link also here as well. So this will be a focus on one specific tool and how to apply that tool to allow you to share best practices effectively within your organization. So another comment, sometimes systematic reviews or meta-analyses I read conclude that there's not enough quality evidence for interventions targeting a mental health issue. What do you turn to then to inform decisions? Yes. Kind of frustrating, isn't it, when you find sources and then they say, well, we don't really know, or the quality is not good enough to really guide decisions. So a couple of things to think about there. One is, remember the pyramid. If we don't find anything at the synthesis or summary level toward the top, it's at that point that we want to think about then perhaps going to single studies. It's not the place to start, but it might be the place that you end up if you're in an emerging field or a field where there's a lot of disagreement in the field about what works. So, so sometimes you need to go to good quality single studies to see what they're finding. Maybe 10 years from now, there will be enough of those good quality single studies to make a systematic review that will conclude something. But if you're not there yet, then you go to the good quality single studies, and you can use appraisal tools that are meant for those kinds of single studies to be sure that you are getting the good ones. The other piece to think about is that Venn diagram model. So if the research evidence is kind of weak or not really helping you, then as you're making your decision, you do want to think about community context, political preferences, other kinds of factors, your own expertise and the expertise of stakeholders around you to help you make good decisions based on what you do know. So even if it's limited, even if there are only a few studies, what can that tell you about what you should do next? And the other thing that I would say is it's really important to try to build in some evaluation into those areas where we don't know a lot. Because you could really help somebody else to answer the same question that you have if you're able to do some evaluation of a pilot project or something that you're trying out so that we can learn from each other and build on those interventions so that one day perhaps yours will be a best practice. So thanks, everyone. We are at 2:30, so I thank you for your questions and your attention, and happy evidence-informed decision-making.